Lead poisoning is a serious health concern that affects individuals of all ages, but it is particularly harmful to children. Lead is a toxic metal that can enter the body through various sources, leading to significant health issues. In this video, we will discuss what lead poisoning is, its symptoms, sources of exposure, the impact it has on health, particularly in children, and the measures you can take to prevent it. Lead is naturally occurring and can be found in the environment. However, it is most commonly associated with human-made materials, such as lead-based paints, particularly in homes built before 1978 in the United States. Lead can also be found in plumbing pipes, certain types of pottery, and even in some cosmetics and traditional medicines. When leaded products deteriorate, lead dust can contaminate indoor air and household surfaces. Children often ingest lead by putting their hands or objects coated with lead dust into their mouths. The symptoms of lead poisoning can vary between individuals and can be subtle. In children, even low levels of lead exposure can result in developmental delays, decreased attention span, and difficulties with learning. More severe poisoning may lead to symptoms such as abdominal pain, irritability, loss of appetite, weight loss, fatigue, vomiting, constipation, and hearing loss. In extreme cases, it can cause seizures, comas, or even death. In adults, lead poisoning can cause symptoms like high blood pressure, joint and muscle pain, cognitive impairments, and problems with memory. It's essential to recognize that lead poisoning often occurs without obvious signs, which is why routine blood testing for lead levels is crucial, particularly for children living in high-risk environments. If you suspect lead exposure, consult with a healthcare provider for appropriate testing. Early detection can prevent long-term health problems. Many people are surprised to learn that lead can also come from unexpected sources. Traditional remedies in cosmetics, such as certain Ayurvedic medicines or kohl, have been found to contain high levels of lead. Additionally, jobs that involve lead, like construction, battery manufacturing, and painting, pose risks for adults if proper precautions aren't taken. It's vital to monitor lead exposure not only in children but also in pregnant women, as lead can affect the developing fetus, leading to premature birth or low birth weight. So, how can you protect yourself and your family from lead poisoning? The first step is to identify potential sources of lead in your environment. If you live in an older home, consider having it inspected for lead-based paint and other potential hazards. If peeling paint is present, consult professionals for its safe removal. Ensure that your home is well ventilated and that you regularly clean surfaces to minimize lead dust. For those working in occupations that might expose them to lead, always use personal protective equipment and follow safety guidelines strictly. When it comes to older plumbing, consider replacing lead pipes or using water filters that remove lead. Educating yourself and others about the risks of lead exposure is crucial. Lead poisoning remains a preventable condition. By recognizing the sources and symptoms of lead exposure, we can significantly reduce the risk of lead poisoning in our communities. If you suspect lead poisoning in yourself or your child, get in touch with a healthcare provider immediately. They can provide testing and, if necessary, treatments to help remove lead from the body. Stay informed and proactive about lead safety in your home and community. By working together, we can protect future generations from the harmful effects of lead poisoning. Thank you for watching, and if you found this information helpful, please like and share this video to help spread awareness about lead poisoning.